Hi, good morning, everyone. Good afternoon. Julian, should we start?
Yes, we're about to start. Just 1 minute. Good morning, good afternoon, everyone, wherever you are. We're so happy to see all of you on this webinar, and we're excited about having behavioral insights as part of our C4D tools. I am Julian Birungi. I am the focal point for health and behavioral insights and inclusion on the C4D team at the HQ. And we're happy to be having this webinar this afternoon or this morning. The webinar will be 1 hour. We'll have a presentation for 25 minutes. And then we'll also have a Q&A after that. Please feel free to share your questions during the presentation so that we don't interrupt the presentation, and we shall be able to respond to them at the end. Also, just to let you know that we'll be recording this presentation for our colleagues who are not able to attend. In order not to take more of the time, I'd like to introduce Vincent Petit, the Chief of C4D at HQ. Over to you, Vincent.
Thank you, Julian, and welcome again to everyone. It's great to see 100 and something people with us. I don't know how much you know about BI. Just want to say a few words of what we're trying to do in UNICEF and in C4D. It's a field of work that definitely went from being trendy to being institutionalized fairly rapidly in recent years. Now we have, last time I checked, over a dozen countries with proper behavioral insight or nudge units in governments. But closer to us, there is also a number of multilateral organizations who have significantly worked and invested on BI. There was the 2015 World Bank World Development Report that was, I think, called Mind, Society and Behavior. I put the link in the chat box. If you've not seen that report, you should take a look. The OECD also has a number of compendium of how they have applied BI to policy development. The EU has a very active lab. So it's something that clearly is not just trendy anymore, and it's in between still being an innovation for some and not being an innovation anymore. And for us in UNICEF, I have to say we are clearly still lagging behind on this particular front. We've worked with Laurie Laurie is going to be one of the presenters today. We've worked with Laurie for the past couple of years, including on a project with Julian and the Lebanon team in Lebanon with some partners from Nudge Lebanon, which went pretty well, actually. 3 weeks ago, there was a meeting between the SG Gutierrez and the heads of the UN agencies, and ED4 mentioned that example, which was, I guess, a pretty good recognition for the work that has been done. More recently, we've contributed to a note that was released by the UN Behavioral Insight Group on leveraging BI for COVID. And also the colleagues in ECARO are actually pretty active on that front. But that's about it, and it's still pretty thin compared to other institutions. So the purpose now is really to shift gears. And that's the reason why we brought back Laurie together with a group of talented people that you're going to meet today. And we want to enter a new phase in which we further include BI in the toolbox, as Julian said. I think that's the right word. And we create some capacity and assets, both internally and externally. So we are at the same time trying to raise a couple LTAs with a couple institutions that have expertise on BI, hopefully to help country offices, get some services. We are finalizing a white paper to explain how BI can help with the programs in UNICEF. And for those of you who know, there's a change management process that the ED is asking for, which will happen soon after the summer. And so we're trying to ramp up our thinking around BI for UNICEF to arrive at this discussion table with ideas about how we can institutionalize it in UNICEF as well. That's it. I have to say I initially approached BI with some perplexity and skepticism when I was not familiar with it. I participated in a few BX conferences where I felt offended that these people would claim the behavioral science field altogether and questioning the applicability of their techniques to the complex social issues that we're dealing with. But then I learned, and I have to say, I value very much their approach, their science, the way they approach measurement for behaviors, their methodology. So I led the team and I explained that, and I hope you get as excited as I am. I'm now a very strong supporter. I want to thank Julian for leading the work for us, and I'll let Laurie and the team introduce themselves. I'm wishing you a very nice meeting today.
Good morning, everyone. Thank you, Julianne. Thank you, Vincent. Thank you all for being here. Good morning, good afternoon. My name is Laurie Foster. I'm a professor of industrial and organizational psychology at North Carolina State University and a visiting scholar at Duke University's Center for Advanced Hindsight. We are really excited to have the opportunity to talk about behavioral insights today, to give an introduction. Hopefully this is the beginning of a conversation that will continue with the Q&A session and beyond. I represent a team that is working with UNICEF on BI, coming from Duke University's Center for Advanced Hindsight, and I'm really happy to have with me today Joey Sherlock. I'd like to hand things over to Joey to begin to tell you a little bit about our team and the center, and from there we'll move into an introduction to BI, including some examples on how it can be applied in the UNICEF context.
Great. Good morning, good afternoon. It's really great to be here with you. So as mentioned, my name's Joey Sherlock. I'm a senior behavioral scientist at the Center for Advanced Hindsight, where we'll go into a little bit more detail about what that is in a minute. I think it's worth saying that I really echo Vincent's points at the start. This feels like a really crucial time for this methodology, this set of work. It feels like we're starting to have really great impact. And so I'm very, very excited that we're having this conversation with you all at UNICEF. Okay, so as a little bit of introduction to the Center for Advanced Hindsight, we're an applied behavioral science research center based out of Duke University, and we're founded and led by Professor Dan Ariely, who's a well-published author, written several books, reasonably well known in the field. Our mission statement is to focus on helping make people happier, healthier, and wealthier using behavioral science, and we look to do that both within the US and abroad. We are so this is us. We are deliberately multidisciplinary. So unlike lots of academic institutions that focus on sort of one specific issue or one methodology, we deliberately bring people together from across the remit. So we have people who are good in the academic space, postdocs, applied researchers, visiting scholars. We have designers, we have developers, and we look to bring those sort of these different fields, these different skills together to help us generate really impactful innovation. Some of the methodologies that we focus on, so Vincent talked about a toolbox, and so some of the tools that we bring to add to this toolbox. One is behavioral economics, behavioral science, and so here we're looking to understand, well, Laurie will go into more detail shortly, but looking to understand how we can apply an understanding of our cognitive limitations, our irrationalities. How can we take evidence on what has been learned in academia and apply it? Then human-centered design, something that hopefully lots are familiar with. It's looking to take the perspective of the user, perspective of the person in the situation, and really understand where they're coming from and what the sort of barriers or pain points that they're facing, and then iteratively developing solutions over time to create things that work. And then finally, I think where other organizations might stop and say, hey, we've developed something really, really great here. People tell us it's good and it looks like it might be working. We look to go further. We look to add in academic rigor and evaluation. So we're looking to test things, ideally using randomized control trials. Where possible, where not, we'll sort of work within the context and use quasi methods. But really, we want to be both building on evidence, but also then contributing to evidence. so that we're making sure that what we do actually works and it's not just a good idea in practice. And that's really important because it enables us to scale and to add value over time. And then, so maybe to summarize this quite nicely, I think we sort of fit in the space, and hopefully the work that we will do with you all will fit in the space between academia, so the evidence element coming through there, the rigor element coming through, applied work. We're really looking to take on, hopefully pithy, complicated real-world challenges and have an impact in the best way we can. And importantly, we want to be doing innovative things. We want to be generating, moving ideas around, generating new ideas, putting things in places that haven't been tried before, and hopefully doing so in a rigorous and evidence-based way. All right, back to Laurie.
Thanks, Joey. So we'd like to start off with the definition of what behavioral insights is, and then we'll walk you through the methodology, how we go about applying this to solve problems, and we'll give you some examples along the way. As Vincent mentioned, the OECD has been quite prominent in developing this out on the global stage, and they've got a nice definition of BI that we provide on the next slide, where they call behavioral insights lessons derived from behavioral and social sciences, including decision-making, psychology, cognitive science, neuroscience, organizational, and group behavior. So I think you're already hearing the message this afternoon, that behavioral insights is very multidisciplinary. It draws from a range of social and behavioral sciences in order to solve problems. If we go to the next slide, I wanted to point out, as Julianne noted, that in the UNICEF context, we very much see this as another tool in the broader C4D toolbox. So as C4D goes about its important efforts on social and behavioral change, this is one tool that can be used. It's sometimes just the right tool, and other times it's exactly the wrong tool. So hopefully with this introduction, we'll begin to get you thinking about what BI is and when is the right time to apply it and when you might not want to. Next slide, please. This, of course, is not the first time BI is being discussed at UNICEF. As Vincent mentioned, we've been working on this for a couple of years. There's a white paper coming out that will talk about BI in relation to C4D and how it can be used as a C4D tool. Here I've pulled a quote from 2016, a UNICEF blog that states, quote, "Embracing the idea that human beings cannot be understood solely as Homo economicus has now inspired a whole new field, behavioral economics, where psychology and economics intersect," unquote. And there are two parts of that I want to point out. One is this notion of behavioral economics. So Joey mentioned that early on, that this is foundational to behavioral insights. So those two areas, BI and behavioral economics, are very closely aligned. And the second term I wanted to highlight from this quote is Homo economicus. So this is a funny phrase that not everybody will be familiar with, which comes from a book shown on the next slide called Nudge. The book Nudge came out in 2008. Cass Sunstein and Richard Thaler co-authored it. Thaler won a Nobel Prize in economics a couple of years ago, in part for the influence of this book. And in this book, Nudge, they use that term, Homo economicus. So that's kind of one of the places where it comes from. And this slide shows the difference between this Homo economicus versus the more familiar term Homo sapien that we're used to. So if you know these two characters on the screen, then I probably don't need to define Homo economicus or Homo sapien at all, but I'll take a crack at it. Homo economicus is this mythical, hyper-rational creature who always makes the best decisions that are in his or her long-term interests. Always weighs the pros and cons, all the facts, all the information, and then makes the most rational choice. I've put this character Spock up here on the screen to represent Homo economicus, hyper-rational. Versus Homo sapien on the right-hand side is depicted by Homer Simpson, but is frankly all of us, right? We get tempted, we get distracted, we can be myopic sometimes, and we're quite frankly human, which isn't necessarily a bad thing, but it just makes it important when we're designing policies and programs for us to take our humanness into account. The book Nudge will state that far too often policies and programs are designed not for Homo sapien, but rather for Homo economicus, and that's a mistake. When that happens, we shouldn't be surprised when people don't behave in the way that we might expect. Of course, this isn't just Spock and Homer. This is all of us. I've got a picture on the next slide that kind of shows the range of emotions that are going on as this woman eats this piece of cake. If I had all 123 of you in the room with us, what I might ask you is this, and I'll ask you anyway. If we were to think back, let's say over the past month, and if we were to be really honest with ourselves and each other, how many of us on this call today have eaten more than we think we should have? Okay, how many of us have not exercised as much as we should have? Yep. How many of us have not gotten as much sleep as we know we should have? And I know Joey and I are both raising our hands on all three counts, and I suspect that that's the case with many people on the call today. Now, do we need somebody to join this Zoom and give us a lecture on the benefits of exercise, nutrition, and sleep? No, I think we have that information. Do we need somebody then to come and persuade us on why it's important to get enough sleep, exercise, and eat properly? No, I think most of us are pretty bought in. But the reality is, as Homo sapiens, there is this intention to action gap. There are a lot of things that we mean to do, but there are things that get in the way of us carrying through our intentions. And a lot of what BI is helping to bridge that intention to action gap, helping to set up an environment that enables people to carry out the things that they know and want to do. If you look at the next slide, I've put up here just a few of the phenomena that lie between that intention to action gap. So why is it that we know we need to eat better, sleep more, exercise more, and we don't do it? Because there are a number of barriers or bottlenecks that get in the way. Things like present bias, the complexity of the world in which we live, status quo bias, inattention, temptation, procrastination, etc. There's a psychologist that some of you will be familiar with named Daniel Kahneman, who also won a Nobel Prize in 2002, largely for his work with his research partner, Amos Tversky, on identifying the different mental shortcuts that we take, the different biases that we have in our thinking process that can often serve us well, but sometimes lead us astray. The thing is, if we take those into account when we're designing policies, programs, and even decision environments, then we can actually help people to make the decision that is in their best long-term interest. So if you move to the next slide, I'll introduce a concept called choice architecture. And that's exactly what choice architecture is all about. It's about taking our humanness, all of those biases and heuristics that Kahneman, Tversky, and others have identified into account, and designing decision environments that will nudge people in the desired direction. I'll give you one small example of choice architecture, and then I'll turn things over to Joey to talk a little bit about BI methodology and an example. So if you look at the next slide, here's choice architecture in action. Very simple example from Keller and colleagues in 2011, where they randomly assign people to either one or the other form. And you can see form one, place a check in the box if you will get a flu shot this fall. That's the behavior they were trying to encourage or nudge. Versus form number two, place a check in one of the following boxes. I will get a flu shot or I will not. Now, for all intents and purposes, these two forms are asking the same thing, but behavioral economics would suggest that people are not equally likely to opt in under these two circumstances. Keller et al. Tested this, and the results are on the next slide. What you can see is 62% of people endorsed an intention to get a flu shot if they were given the form on the right, which is called active choice, versus 42% of people endorsing the intention to get a flu shot if the form was simply an opt-in on the left. So a very small change in the decision environment that leads to a significant difference in intention. One small example, we'll give you a couple more, but let's talk a bit about BI methodology, the systematic process that we use to move from a problem space to a testable solution.
Great. So I'll pick up and walk through some of the methodology points that we like, or the stages that we like to draw from. So using this framework, so we have 4 main stages. We look to funnel projects as best we can through each and spend time developing the ideas at each stage. So the 4 are define, diagnose, design, and test. And so to give a bit of an example, or maybe just to explain a little bit more, in the define section, we're really looking to understand the problem and trying to be as specific and targeted as we can be. So rather than being reasonably vague, like we want to reduce obesity, we would look to be quite precise and say we want to increase the amount that people exercise to at least 3 times a week for 30 minutes each time. In the diagnose phase, we're really looking to understand the problem. I think one of the things that this work or this approach really brings to the table is a sense of humbleness. We don't really we have a good understanding of psychology and how it works, but there are so many contexts that we don't fully understand, and context really matters. Understanding the nuance, the pain points, the barriers. We talked a little bit about using human-centered design principles before. And so in this diagnose phase, we're trying to get into some of that, trying to use primary research in terms of like qualitative research, looking to use surveys, looking to use secondary data, and also to read the literature and the other work that's been done in the space to really get a good grasp on it. Then we're looking to end the diagnose phase with hopefully a long list of possible ideas that can overcome the barriers we've identified in this phase. And then in the design phase, we're looking to take an idea from words on a page all the way through an iterative prototyping process to get to something that works in the real world somehow. And so, you know, this is classic human-centered design, but also potentially leveraging laboratory studies, and I'll talk a little bit more about that in a minute, and little pilot tests to get things to start working. And then finally, as mentioned, we're looking to test. We're looking to run randomized controlled trials to add rigor to the work. So one example to walk you through here, one challenge that was faced by farmers in Kenya was that they weren't necessarily using enough fertilizer. And so they were missing out on harvest yields. And what's more, when farmers were asked, would they like to use better fertilizer, about 98% of people said they would. So drawing on Laurie's point about intention behavior gap, here's a classic example where people want to do it, but then don't end up following through. So defining the problem is quite clear. Not enough farmers use fertilizer, even though they intend to do so. So in the diagnosis phase, how can we understand this? And through this process, one of the things that came up was this mismatch in time. So people or farmers have a harvest, they are flush with cash, they have lots of money available to them, and they could potentially at this point buy fertilizer. However, they then spend it throughout the year naturally, and then when it comes to the point at the planting season at the beginning of the next season, they don't necessarily have the cash available. So it's difficult to outlay the investment to invest in fertilizer. Also, it's a little bit of a hassle, right? So getting fertilizer is potentially another job when you're busy. There's lots of things you need to do. So moving into design. The solution that was designed in this example was one where they changed the time period. Rather than having to buy fertilizer at the beginning of a season, they gave people the option of buying vouchers at the end of fertilizer, at the end of the harvest season when people were flush with cash. And to reduce the hassle, they made it delivery, so that rather than having to walk for 30 minutes or more to go and get it, it was delivered for no extra charge to the farmers. Of course, then they tested this in a randomized control trial and found that this solution led to a significant increase in fertilizer purchase. Okay, so an overview of the methods, an example to illustrate. I now want to spend a little bit of time zooming in on one of the methods that we use quite a bit, and hopefully something we could potentially use with UNICEF over the coming weeks and months. And this is rapid pre-testing in the lab. So this is using lab studies, which so often in academia are used to generate theory and help develop theories. We like to use it in a more practical and applied way. And I'll talk you through an example of that next. So working with the British government in the UK, we worked with the Treasury and HM Revenue and Customs on a large program called Help to Save. This is a savings program that is designed to help low-income people. It's targeted at people who are on tax credits, who are very low income, relatively low income in the UK, to save some or more money. And so one of the intervention options we were given was they were sending out messages to encourage people to save. And we had, I think we'd done our power calculations and we realized we had about three slots available. We could run 3 different conditions. However, we had lots and lots of ideas. You can see on the slide here, we have at least 9 or 10 different possible things that we could put into these 50-odd characters you get in an SMS message. And so we have this problem where we don't know, evidence is suggesting or the research is suggesting that these are all good ideas. And so what do? Here's 2 examples. Intention behavior gap was one, and identified as eligible. This is the sort of the intervention space we're working with. So what we did is we took all 10 of these ideas and we ran some lab testing where we asked hypothetical behaviors in an online survey with an online panel. We asked people, imagine you received this message, would you save? What is your willingness to save? And we tested these against each other. As you can see, this graph shows us the differences in interest in the program. So we explain what the program was. Higher is better, and you can see we have all of the different messages laid out along the bottom. On this outcome, the best performing ones were the intention behavior gap, the identified as eligible, and the program initiation message. All had a 5.5 rate on this one. Then we had differences in how much hypothetically would you pay into your account each month. And we see the intention behavior and the identified as eligible performing best on these. And then finally, how interested would you be to learn more? And again, we see these 2 coming out on top. So what this enables us to do, this lab testing enables us to take 10 different messages and for what it's worth, I didn't predict these. I think I was predicting this FOMO one was going to be the best, and I was sort of hanging my hopes on that one. But it's so easy to be wrong. We don't necessarily know what works in any given context. So we took these 2 that were performing well in the lab testing and took them through into a field environment. We then ran the field test, and so we had a control group. We had the question behavior effect, which is these 2, and we had the identified as eligible as these 2, and then we had just a clean and simplified, which is these 2. We also, then you can see, we varied whether we personalized the messages or whether they were not personalized. And this was a practical test. We wanted to know whether the extra effort that went into the personalization was worth it. And what we found was that broadly, the 2 interventions that we selected did better than the simplified and much better than the control, and also that the personalization element worked. I don't think it was significant, but this identified as eligible one was probably a hair better, and it was the one we recommended they roll out. So that's just a nice example of how we can use rapid laboratory testing, pre-testing, to develop ideas to then roll out into the field. Okay, back over to Laurie.
Thanks, Joey. So as this methodology in the slide shows, this process of define, diagnose, design, and test often includes leveraging the scientific literature in psychology and behavioral economics and beyond. It can include elements of human-centered design, rapid pre-testing, as Joey has pointed out, to quickly guide us in the right direction. And it also often includes field testing, where the rubber meets the road, so to speak, which can include combinations of nudges. Combinations of nudges sometimes means trying one versus another to see which works best, or sometimes it means packaging them together. So when I talk about nudges, I'm effectively talking about the different behavioral insights tools that behavioral economists often use in their interventions. I put just a few of them here on the screen. There are many more, but they include things like the clever use of defaults, active choice, which we looked at an example of with the flu shot example I showed shortly before, simplification, implementation plans, reminders, etc. So these are all what we might call behavioral insights tools or nudges. And it's not necessarily just a matter of using one or another. Sometimes they can be combined, which leads to this next example that I want to show you. It's both an example of a field test in UNICEF context, and it's also an example of how you can combine these nudges to go together. I like this example because one of the weaknesses, of course, of the Keller et al. Study I showed you a while ago is that we were just affecting intentions through choice architecture. This example has to do with vaccinations, but it's looking at actual behaviors in the field. So this was a pilot test with over 6,000 households that was wrapped up about a year ago. And if you move to the next slide, I will show you the different nudges that were embedded in this pilot test. But first, let me give you a broader context. So effectively, the define, right? We wanted to define what kind of behavior we wanted to achieve. And ultimately, we were looking to increase people's immunization activity. And Julianne was quite involved in this, and so she can also answer questions or weigh in. But there was a program running called AIA, Accelerated Immunization Activity, where there were outreach workers going to households. There was already a program running to try to accelerate immunization activity in Lebanon. Our question was, is there a way to use behavioral insights to even boost the effectiveness of that existing program? And the answer was, we don't know. And therefore, let's try to figure that out and let's test to see whether we can come up with something that works. So once we had defined the problem space, we moved into that next phase, which was diagnosing. Why aren't people getting immunized at the rates that we would hope? There, we conducted a very detailed behavioral mapping to really try to get a sense of what was going on, what were the barriers or the bottlenecks. And once we had a sense of that, with Nudge Lebanon's help and leadership, moved into this design phase. This design phase was trying to figure out from the academic literature, other studies that have been done, what do we know about things that might encourage people just a little bit to go into the healthcare facilities and get these vaccines. And what you can see from the screen here is we embedded into a calendar 5 different nudges. So you've got social endorsement, social norms, a commitment device where people, kind of checked off, I promised to vaccinate my children. You've got a planning tool, this calendar that was on the form, and you had a trusted messenger, the seal of a trusted messenger down at the bottom. This was a calendar that the outreach workers then went and gave to the households when they were doing their visits anyway. However, there was only a random subset of the households or the outreach work teams that distributed this calendar. This enabled us to compare the households and the regions that had received the calendar to the households and the regions that were just receiving the visits to see whether at the end of the day there was a difference in immunization activity. If you move to the next slide, you'll see what this actually looked like because it was in Arabic. So for those of you who speak Arabic, this will make some sense. But again, you can see that it had the different nudges embedded. This was a co-creation process, by the way, with the Ministry of Public Health. So I distinctly remember being over there in Lebanon and a visit. Julianne was there as well to take the prototype into the ministry and get their feedback and their input. So it was very much a collaboration between UNICEF, Nudge Lebanon, and the ministry as well. If we move to the next slide, you will see the results of this. So long story short, it worked. The treatment households are over on the right-hand side of the graph versus the control households on the left-hand side of the graph. And we saw a 6.8 percentage point difference when we were measuring the actual immunization rates from the data from the healthcare facilities as to who was getting immunized. This would suggest, put a different way, an additional 6,800 households will vaccinate at least one child with BI if the intervention is scaled up to reach 100,000 households. So next slide. There are just a couple of things I wanted to point out about this example. It's an example of using multiple nudges at once. It's an example of field testing to see whether the idea works. It's an example of the fact that small details can make a difference. Just these little details in this calendar that was left at people's house can make a difference in their willingness to go to the healthcare facilities and immunize their children. What strategies were used? What strategies were not used? So what strategies were used, as you could see as I was walking through the example, we used this very systematic define, diagnose, design, and test process that Joey described. It was a co-creation process with the ministry, a collaboration. And it was a scalable process, right? So we picked an intervention that if it worked, could realistically be scaled up to a large number of people. All it takes is the resources to produce and distribute that calendar. What strategies were not used? We didn't try to educate anybody on the importance of immunizations. We didn't try to persuade them. We didn't spend a lot of time and didn't spend a lot of money. So it was a relatively quick, straightforward way of seeing whether or not these nudges affected behavior, which in the end, in this context, it did. So if you look at the next slide, I want to wrap up with just a couple of quick thoughts. So one is to point out that we have given you a couple of examples, immunization, savings, but the reality is that this methodology, BI, can be applied to many, many different problem spaces. We've been in discussions with polio. We've read over the Independent Monitoring Board's report and are looking at different ways in which BI can be applied to polio, both to increase the acceptance of polio vaccine, but it can also be used in other parts of that polio ecosystem as well. So for example, figuring out for frontline health workers how to enable them more effectively through BI. Of course, BI can be applied to COVID-19, many aspects of it, indeed. It can be applied to things like hand washing, wearing a mask, staying at home while sick, social distancing, but it can also be applied to things like helping to protect people from misinformation and other challenges such as schooling your children from home when you hadn't done that in the past, easing some of those burdens. It can be applied to adolescents HIV, youth employment. Work in organizations is becoming increasingly common. The OECD, the European Commission, and others have been focused quite keenly on applying BI in organizational contexts. So we can begin to think about even within the UNICEF organization how BI might be useful to enable us to be our best selves at work and get used to working from home and all these Zoom calls. The Joint Inspection Unit came out with a report about a year ago on applying on change management within UN system entities at large. And if you look at that report, you'll see a section on BI talking about how we need to be using some of these behavioral principles to enable our change management processes. So finally, if you go to my effectively last slide, I just wanted to mention that hopefully understanding BI, how to use it, will expand our thinking, right? So in the C4D space, as we're thinking about social and behavioral change, BI isn't going to always be the right tool, but it might expand our thinking, give us an additional tool to consider as we're approaching these problems, and enable us to test those solutions, hopefully to affect the desired change, and then finally to scale up. So let me pause there, and really looking forward to your questions, your comments, hearing what you think, and yeah, continuing this dialogue.
All right. Thank you so much for a wonderful presentation, Joseph and Joey and Laurie. Hi, everybody. I'm Emily Ramos, and I'm here with my colleague, Saba Fatima. We're both from the C4D team in New York headquarters, and we will be moderating the Q&A session today. Thank you so much for everyone that's already given their questions in the chat box. Please continue to send them over, and we'll collect them. And to start us off, I'll pick a couple of questions that came in about applying behavioral insights in UNICEF. So the first one is, for those interested in applying behavioral insights to our work, how do we start? And the second question, which is very interesting, is, what is the current thinking and planning around connecting the dots to synergize advocacy communications, programming, and BI knowledge more systematically across UNICEF? I think some linkages have been established between BI and fundraising already. All right, we'll start with those two first. Laurie?
Sure. So how do we start? I think we're starting today, so that's a good sign, by kind of familiarizing ourselves with the concepts, the methodology, with this notion of taking risks, calculated risks, and testing whether they work or not. Hopefully we start with a mindset of intellectual humility instead of assuming their ideas will work, of testing them. And then I think that part of this is a fundamental question for UNICEF, is to, you know, like, how as an organization, are we going to make sure that the resources are available? We as a team are quite excited to be a resource. There are also, I think, a number of other UN entities that are grappling with this as well, you know, realizing the usefulness of BI approaches and figuring out, you know, how to both partner with each other and partner with academics and others to help them move forward. So Julianne mentioned white paper coming out. I think that's also going to be a really good starting point because it really talks about BI in the UNICEF specific context. Other than that, a good reading for those of you who haven't seen it is the book Nudge. Highly recommend it. There's also a book by Daniel Kahneman published, I believe, in 2011 called Thinking Fast and Slow, which talks about some different BI concepts. And I would be remiss if I didn't mention that our dear friend and colleague Dan Ariely has written several best-selling books, one called Predictably Irrational, that covers some of these concepts. Joey, thoughts from your end?
I think that's a really, really strong answer. I think maybe from a practical perspective, if you're working on projects where you think these tools might be useful, I think I would suggest starting with the problem or problems and working up from there and trying to get as specific as you can about what is the problem, what is the behavior that you're trying to change in your project, in your context, and seeing whether, you know, reading and working with others, seeing whether that problem, that behavior is amenable to a behavioral approach. Like, you know, as mentioned several times, it's a tool, it's in the toolbox. It's not useful for everything, but it's useful for lots of things. But understanding the problem, I think, is the best place to start.
Yeah, I think that's a great point. We talked about that DDDT, define, diagnose, design, and test. And it's really easy to gloss over that first bubble, define. You'd be surprised, actually, that proper investment of time in that bubble, define, can reap a lot of benefits. Said another way, Joey walked us through that example of using fertilizer in Kenya. And you can easily imagine how that conversation started. You know, it probably started, you know, with, we're working on SDG 2, you know, ending hunger. It's like, all right, well, you know, what are the specific behaviors though? Well, we want crops to be more, you know, productive. Okay, but, you know, what do you want to see people doing differently that they're currently not doing? And so drilling down from, you know, the SDG or the programmatic area to really understand the measurable behavior that you want to see change, that's going to move the needle. Takes a little bit of time and thought, but can really set you up for success for one of these projects.
Thank you for that. We also have two more questions. The first one is, can you please share some examples in applying BI to fighting violence against children, including sexual violence? And then the second question is, do you have any examples from complex conflict environments where behaviors have been highly politicized? An example, vaccinations is evil, or using masks is a left-wing thought. Thank you.
Sure, thank you for those questions. They're very good ones and important ones. I think that part of my answer is going to be BI is not a magic bullet, and it's not the right answer for every problem. So I tend to think that BI its sweet spot is this intention to action or intention to behavior gap that we've been talking about. That's not the only way that it can be applied, but I think that is a real sweet spot. It's not usually as good for changing people's minds about something that they, you know, feel passionately against. That's where I think some of the other C4D tools might be more appropriate and more useful. So when we think about things like violence against children, I wouldn't say, nope, you know, can't use BI for that. But what I would say is BI would tend to be more useful for some of the small drivers, right, that are leading up to violence against children. And you as UNICEF have done such a good job mapping out and identifying those drivers. So some of those smaller drivers, I think, are probably more amenable to nudges in terms of, actual, the big problems of, FGM, violence against children, child marriage. I don't think that a nudge is going to change anyone's mind about something that they feel strongly about, including in the vaccination context. So, yeah, I think that that I would underscore that, focus on drivers. So BI, to give a concrete example, could be helpful for, getting people to enroll in a positive parenting class, or even getting people to use those new knowledges and skills when they're at home after they've left the positive parenting class. So it, it feeds into this bigger problem space without necessarily changing somebody's mind in a dramatic way.
Maybe I just jump in a bit on the vaccination point. I think this is a really good, difficult challenge. So when we think about people across the spectrum of vaccination adherence or vaccination behavior, one end of the spectrum, we have people who are always going to do it. They're going to go to some extreme, they're always going to get vaccinated. Then in the middle, we have this sort of more gray area where we have people who are amenable to vaccinations, who would get it if we made it easy, if we persuaded them, if their friends were getting it, or if they that year they knew someone who was particularly sick. They're amenable, but they're not the diehards. And then we have the people right at the other end, who I think you're referring to, who are the ones who are really hard to change. These are the people who are anti-vaccination. Typically this population, I think there's a paper that showed it's only about 5% of the population. It's reasonably small, but of course they're quite vocal, and so probably take up more attention than we would hope. So when we're using behavioral solutions, a lot of the success in behavioral solutions, as Laurie was focusing, is success in moving the needle on those gray people in the middle. People who this is a large group of people who have intentions to change behavior but don't necessarily do so. So I won't talk about examples in there, but there are lots. Talking about examples specifically on that small group, the anti-vaxxers, some of the things that I think have been tested. One is paradoxical persuasion, I think it's called, and it's where I'm not sure if this has been applied very well, but it's a really interesting idea that I'm curious about. And it's where we take a person, in this instance they're an anti-vaxxer, and we drill down on all of the things in that bucket of arguments and make them increasingly ridiculous. So like vaccinations are bad because it means that the biggest people at the top, President Trump makes money every time you don't get a vaccination, or every time you get a vaccination, getting increasingly ridiculous. And the point here is that if we push people to the limits of their understanding of their logic, we can show them how crazy and ridiculous it is. So I think this has been used, we talked about lab studies earlier, it's been used in lab studies in this sort of context. I don't know how well it's been applied. But that's one example of how we can look to use psychological principles to change tricky things like that.
And the psychological principle that is being tapped into there is something called cognitive dissonance. And so cognitive dissonance is this uncomfortable state of perceived self-inconsistency. And it turns out that Homo sapiens, human beings, do not like feeling inconsistent. And we're highly motivated, all of us, when we start to perceive that we're being inconsistent, to reduce that dissonance. And that often leads to changing our minds. So in Joey's example, if you can no longer agree with this anti-vaccine statement that's so extreme, then you're confronted, even subconsciously, with, how can I hold this view and disagree with this statement? And oftentimes, to reduce the dissonance, you let up on this view that we're trying to back people off of. So a very clear example of how using these theories from psychology can actually lead to applications. The other addendum I'll make to my previous answer, where I said, focus on the drivers, yes. Also look at other aspects of the ecosystem. So in that complex conflict zone. If in fact BI is not going to be useful, let's say to change somebody's mind about something about which they have extreme views, what else in that system might BI be useful for? So for example, perhaps you've got a workforce that you need to train and motivate and be effective in that context, a workforce that's on your side. then BI can often be useful for enabling, either by giving them tools, the way that we gave the frontline workers in the Lebanon examples, we gave them BI tools to hand out, or enabling them through training, through motivation, and through inspiring better performance.
Great, thanks so much for those thorough answers. And are we ready to go on to the next question? Yeah, okay. So we have a little bit of time left. I'm going to take 3 questions at once. 2 of them are related to applications for COVID-19. So any ideas on how to integrate behavioral insights and nudges into C4D in the current context of COVID-19, especially when we are dealing with the infodemic? And related to that, how do we apply BI in the context of extremely low uptake of public health preventive measures, given the current COVID-19 pandemic? So those are the 2 questions for COVID-19. I'll take a third one, which is related to UNICEF applying behavioral insights. A colleague said, thank you very much for your presentation. Up to the define and diagnose stage, UNICEF staff might be able to figure that out, but we do not necessarily have strong research and choice architecture, design and evaluation technical capacity. How can we get some support on design and evaluation stage? I could not find a good agency or institution to design and evaluate BI so far. Do you have any tips on that? Over.
Great. Joey, do you want to take those first and I'll follow up?
Sure, I'll take a crack. Maybe starting with the middle one. I'm sorry, I was trying to write as we go, so I may have missed some of the details. But low uptake of preventative public health measures. So you're filling in some of the gaps. For example, hand washing, wearing a mask, social distancing in relation to COVID. I think one of the main things, one of the big lessons from behavioral science is really, let's just make this easy. Let's make it as easy as possible for people to comply. So in the context of masks, let's give people, one of the things I think hasn't been done well is let's provide people with free masks. Let's give them, make it easy for them to comply so that it becomes more of the norm. By changing the default here from like you don't have one and you have to go out and get it to you have one and you may as well wear it, we're implying an injunctive norm. This is what we think you should do. We're providing a descriptive norm. Most people are doing this, and we're reducing friction. So that would be an example. Similarly, hand sanitizer going in and out of locations. Let's just make it as easy as possible. Let's have people giving it out, making it hard to not comply. Another thought is to think about the social ecosystem within which people are operating. So carefully thinking, and maybe this sort of segues a little bit into the C4D question, the first one, but think about the messenger. It's not the case that all people, so the messenger is really important, who delivers the message. And across, we see this a lot in the US, people on different sides of debates, at different sides of the political spectrum, respond very differently to different messages. And so it's really important that when looking at specific groups, we think carefully about who's delivering the message as much as the message itself. And similarly, sort of linked to that, I think one of the challenges that's emerging around COVID, I mean, speaking from a US context, maybe this is a little US centric, but I think it's also true in the UK and some of Europe, is that it's becoming as much a political issue as anything. And so it's becoming about identity, complying with preventative health measures or responding well to C4D communications is about whether you identify with that cause. And so looking for ways to align these behaviors with different sets of identities. So on the one hand, it's you wash your hands because science, right? And on the other hand, you wash your hands because freedom and because we want to protect America. And there's sort of different, you can imagine applying that in other contexts, but looking to draw on different identities to enable the same behavior in different groups. And then the final one, and I realize we're close on time, design and evaluation agencies. I think we would love to help, but also there are lots out there. Behavioral Insights team are good. The design Ideas 42 are good. I think it's probably worth mentioning there are lots of other smaller ones as well who get stuck in. But I'll pass over to Laurie and you go for it.
Thanks, Joey. So yeah, I think that I would love to, in a moment, hand things over to Vincent. He might also have thoughts on the support for BI. We are really excited to be serving in that capacity, working with polio, working with COVID, and potentially some others who are on the call. So we appreciate that opportunity. I'll just add one thing on the COVID front, and because I don't think it's come up very much, is this notion of misinformation, right? Obviously it's running rampant all over the world with respect to what to do, what not to do, you know, what is COVID, what isn't COVID, you know, what's the guidance now that we're heading into the holiday season. And I do think BI can be very useful in helping to protect people from misinformation. There are some interesting approaches out there looking at, for instance, how giving people weak attacks on an attitude up front can actually, almost like a flu shot, can build up resistance to a stronger attack later on down the line. Sometimes that's referred to as attitude inoculation. It can go by other terms as well. But the point is that we're quite interested in the COVID context of testing some of these approaches, perhaps even pre-testing them to see whether there's a certain type of messaging, almost counterintuitively, kind of giving people weak attacks on something that we know is wrong so that they build up reasons why when somebody later on down the line gives them something that's completely false, why those things aren't true. It's also a very cool game out there called Bad News by John Rusenbeek, who studies fake news. That could be interesting to test in different contexts as well, that literally helps people identify misinformation when it comes your way by the little signals, and is hopefully a way to protect people in that manner as well. So yes, lots of interesting applications to COVID. Let me maybe pass the baton over to Vincent. You probably have thoughts on this notion of support for BI. Would love to hear what you think.
Yeah, thanks, Laurie. Thanks, everyone. And we are reaching the end, and I'm going to have to disconnect. But yeah, it's a bit frustrating because we have little time. And I mean, knowing both worlds, I can understand how the colleagues' questions show somehow that the understanding of what BI is actually, I mean, we transpose the understanding of what we do onto BI. So I would have loved to, maybe next time we can explain how that fits into a larger change process and how some marginal efforts have multiplying effects using BI at different points of the work that we do. But on the questions that have to do with institutionalizing, connecting the dots, the lack of capacity, we are currently, as I said, thinking about what type of model could work for UNICEF to do that in a strategic fashion. I don't have answers yet, but my thinking is from the institutions that are now leaders in this field, I don't think any of them succeeded without having some type of internal capacity. That's one. And I don't think any of them succeeded without good partnerships as well. So I would say it's probably about striking the right balance between having UNICEF dedicated capacity and not only relying on external people, but also having a large set of partnerships, especially when it comes to implementation on the field. Because it's fine to embed a couple BI experts in HQ or in a few regions, but that's not where the work is happening. So that's the combination that I would try and strike. I'm not sure it's with the evaluation people though, because RCTs, I mean, the evaluation function in UNICEF doesn't look at things like RCTs early on in the programs. Maybe we can work with them on that. But to me, that capacity has to be closer to programs themselves. And that's a bit tricky. People in Innocenti, we've been talking with Ben as well, Ben Hickler. Innocenti could also be a good place to embed some of these internal capacity. Now, the process to reach that, as I said, there is both the change management process, for which I need to come up with a suggestion to the senior leadership about how we can concretely mainstream, strengthen, embed, and everything is on the table and is going to be discussed in the coming month. That being said, there is also a process of multiplying the exposure of the UNICEF staff to this field of work, and the best practices to put that thing on people's brain map, and make sure that they know this is something valuable. And then if they have the resources handy to be used, that's probably the right combination. So hopefully, if there is interest, we can organize more in-depth webinars around these issues. We could even discuss with you, the team, and others, developing some master classes or some types of more in-depth training for people who are interested. That could be with lead thinkers for senior managers. I wouldn't mind having Dan talking to ED and the DDs for some time, and having that level. But that could also be at the very technical level with not only the C4D colleagues, but all of the sectoral colleagues, and going more in depth into everything we've discussed today, because looking at the questions, it is clear that there is a lot of interest, and it's a huge opportunity for us. So that's the process that we will be following in the coming 2-3 months to try and answer some of your questions. If you have suggestions, ideas, thinking of how we could take them from the corporate perspective, like from an institutional perspective, please feel free to send them to either me or Julian or Laurie or Joseph. It's going to reach us anyway. So that's it. I know we're late. I just want to say thank you to Laurie, Joseph, Julian, Emily, the entire team. Over back to you.
Thank you. Thank you both, Joey and Laurie, for answering these questions, and to all of our attendees for taking the time to ask them. That is all the time we have to answer questions, unfortunately. For the questions that we did not manage to answer live, we will be sharing the questions with the presenters so they can answer them and get them to everyone on a post-webinar report. We will also be sharing the PowerPoint presentation and recording of the webinar with everyone as well. At this point, I would like to turn it over to Julianne for some final words. Over.
Thank you, and thank you very much, everybody, for the interest and for joining and for being part of this discussion. We can see there is a lot of interest, and we're working towards addressing those interests. As Vincent said, we are also actually looking at having a module or a training module on BI to see how we can better ourselves internally. We are also looking specifically with the polio team that has come running onto this and they want to do it. We have a webinar, I think, on the 22nd, specifically looking at polio and BI and how they can use it and go into the nitty-gritty. So we'll be having many more of these to bring you up to speed. And please feel free, if you think your country would like to try this out, send in messages. We'll have Laurie and her team to work with us. And we also have the LTAs, as Vincent mentioned at the beginning. So thank you very much, and thank you for being part of this webinar. I think we come to the end. Emily, you have anything else you want to say? But over and out, thank you everyone for joining.
Thank you very much, Julianne. I apologize, that was an audio problem. Thank you very much, Julianne. That's it for us as well. Thank you to all our participants for coming. Keep an eye out for an email with all of the items that Saba mentioned we'll be sharing after the webinar. Over.
Thanks, everyone.
Thank you.
Take care.
Bye. Thank you, everyone.
Bye-bye.